You can. Some people like their showers later, in the evening, but if they want a shower, do the oral care, get them dressed for bed.
Excellent.
Some
Dressing them
some
for bed. Mhm.
compression socks. Some like compression socks to be taken off.
Hmm. And this is also a good time for back massages. Keep them relaxed, right? Okay. So, um, and keep in mind, patients often are in a dependent role and need assistance from the nurse in carrying out personal hygiene. There's a reason why they are in these types of facilities, right? There is a reason
Mm-hmm.
why they're being admitted in the hospital or the long-term care facilities. Okay, that means they have some degree of needs. Okay, in certain areas of care, they might be dependent to a healthcare provider, a nurse, or a CNA, right? Okay, and this is one way of us helping them in achieving this goal. All right. Is it important for personal hygiene for nurses? Definitely, right? Okay. So that
Mm-hmm.
means if you work, before you go to work, make sure you take a daily shower or bath. Okay. We don't encourage you to be wearing strong perfume. Some patients can be really, really sensitive to the smell. Right. Uh, wear clean undergarments every day. Okay. Wear a clean uniform every day. You want to look professional. You want to look neat. Okay. You want to look and smell good. Right. Keep the fingernails short, clean, and well manicured. Okay, although we don't encourage students during clinical for any colored polishes. Okay, artificial nails is a big no-no as well. Even in real clinical practice, you're not supposed to be wearing them. Okay, that can harbor a lot of bacterias. No colognes. Okay, if you smoke, if you're a coffee drinker, okay, always use breath mints. Okay, some patients can be sensitive to this smell as well. All right, so your own practice of your how you define your own personal hygiene matters. Okay, but keep in mind, okay, as nurses, you're going to be the role models for this patient. Okay, you can't teach them proper hygiene if you're not maintaining your own personal hygiene as well. Okay, so we pretty much we teach them. Okay, we apply what we teach and preach for them. Right. All right. This could be what is the important. What are the responsibilities included here? Okay, when we perform hygiene for the patient. Okay, it preserves the patient's well-being. Okay. Number two, encourages the patient's independence, respect the patient's privacy. Okay. And very important also, another important consideration is you always give important consideration to their preferences. Okay. When you're offering them bed bath or showers, we always ask them their preferences. Right? Someone mentioned some patients prefer doing it at night. That is your personal preference, and we need to respect that. Okay, or I'd like to do it after breakfast or after shower, and maybe we, as busy as we are, okay, there will always be ways where we can accommodate this request. Okay, we are trying to maintain your dignity by also respecting their desires. Okay, so that's very important. Privacy is also very important. All right, we have some magic numbers here. That means this can appear in your quiz. Okay, so make sure you take note on this one. If you're not on my slide, you can go to the page on your book. I don't know what page it is. Okay, so the recommended room temperature, know your ranges, please. Very important to know. It's between 68 to 74 degrees Fahrenheit. Okay, room temperature. Pay attention to keywords. All right, we're talking about room temperature. Okay? On the extreme ends, in both infants and the older adults, okay, they may require a warmer environment. Okay. In terms of ventilation, if they can tolerate a good open window, that would be nice to remove the stale air. Okay. But room temperature, that is a magic number. That means that's a need to know. Okay. All right. Who wants to volunteer read this one, please? Let's.
Hygiene practices. Older individuals are more likely to become chilled during bathing or when left uncovered. Maintain a warm room temperature than for younger people, and keep drafts to a minimum. Drape older adults properly during care to prevent chilling and provide for modesty. Older adults with limited mobility may need assistance in perineal care. Use of a sideline position increases the patient's comfort and provides the nurse with opportunity to provide perineal care and inspect surrounding skin. Perineal care should be performed daily and after each episode of incontinence. Impaired circulation and neurologic changes sometimes decreases the older person's ability to sense temperature changes in the water, so use caution to prevent burns during tub or shower bathing. Too frequent bathing and use of detergent soaps can have harmful effects on the skin on most older adults. Determine the type and frequency of baths and the choice of soap based on individual needs. Rehydrate patient's skin with lotions and fluids. Immobility, incontinence, and poor nutrition increase the risk of skin impairment in older adults. Adequate diet, frequent change of position, use of pressure reducing devices, regular toileting, and proper prompt cleansing of the skin after incontinence to reduce risks.
Okay, it could be a select all that apply. Immobility, incontinence, and poor nutrition increase the risk of skin impairment in older adults. Okay, let's discuss this immobility. How does it affect? Why does it result in skin impairment?
If they don't move you around enough, you can get pressure ulcers.
Okay, what about incontinence? If they're incontinent to their number two and number one, does it have an effect on the integrity of the skin of the patient?
Yeah, it
Yes.
becomes way more sensitive, and infections can lead little cuts and stuff.
Okay,
And then you have to provide the care for it.
that can lead to skin maceration, right? If they get soaked with liquids or fluids, in this case urine or the fecal materials, okay, and that can also increase the risk for infection. Okay, poor nutrition, okay, in terms of maintaining the skin integrity, good nutrition is also important. Also keep in mind why is burns very important, very high in terms of injury to the older adult. Their reflexes are slower. Okay, for you younger people, if you touch something hot, okay, you can have that reflex action of withdrawing it right away, right? You sense the pain right away. For these older adults, before they can determine, oh my God, it was pretty hot, okay, they already burned their skin. Okay, that's why burn is one of those highest in terms of incidence among the patients, the older adult population as well. Okay? So older adults with urinary incontinence needs meticulous skin care to reduce
Well,
skin irritation from urine and feces. Okay, so there will be changes during the aging process. Okay, and these changes contributes to changes in voiding and defecating of these patients. Okay, so often the aging patient needs immediate response to a request for a bedpan or urinal or assistance to the toilet. Okay, incidentally, how would you determine whether the colight is coming from the toilet or coming from the bed of the patient? If you're in a hallway,
Red light and the toilet.
so in some facilities, there's a red light. That means it's the toilet. That means you need immediate response. Uh, if this is continuously blinking light, what does it tell you? Where is the patient calling for help? If you see the lights on the hallway, on the patient's bedroom, and it's continuously blinking, what does it tell you?
does that mean they need help in their room, like in their bed?
That patient is mostly using the toilet. Okay, if the light, remember the hallway lights in each of the rooms, they have their lights, the call lights, right? Okay, if it stays on, not blinking, usually that signal is coming from the bed of the patient. Okay, who do you need to respond faster? The call light coming from the toilet, or the call light coming from the room, the bed?
Toilet.
The toilet. Okay, so
So it could be
that is
a
pretty
fall
important to know.
as well.
Although in both cases we need to respond promptly, but between those two lights you need to respond faster if the call is coming from the toilet. Okay, so just simple things that you need to remember. All right. Decreased production of saliva in aging necessitates more frequent oral care. Okay. So that means the drier it is, okay, the more likely that there can be injuries to the patient. It can result in cracked lips, okay, growth of bacteria, okay. So that means we need to also give important consideration in that one. As you grow older, okay, your ability to produce saliva also starts to go down. Oral hygiene practices help older adults preserve their ability to eat, okay? And the two important things that you must remember in terms of oral care, number one, okay, you maintain the health of the mouth, the buccal cavity. And number two, which is very important among the older patient, would be the oral care helps improve the appetite of these patients. Okay? So if I ask you a select all that apply question, or maybe give me two important reasons why oral care is important, okay? Would you be able to name them? What are those two again? Let's see. You can remember if you're paying attention. Number one is what? Why do we perform oral care? Come on.
For their mouth, to keep their mouth clean and
Okay, that's one. Keep their mouth clean. What's the other important reason why we perform oral care?
For their confidence, like for
I just said it. Improve the appetite of your patient.
Yeah,
Remember those two. Okay. Maintain the good health on the mouth. Number two, improve the appetite of the patient. Okay. So that's very important. So that's in terms. We're going to be talking about more oral hygiene when we go forward with this chapter. Okay. So always treat the patients with respect. Okay. Keep them well groomed. Okay. That is very important. How they look, that would have a serious effect on how they present themselves, how they behave themselves. Okay. In terms of nails, we're going to be talking later on. Okay, what is the proper way of caring for nails of the patient? Okay. Volunteer for this one, please. Let's see if I can hear another voice. Let's see. Don't be shy. Let's go. Let's keep moving.
I can read it.
Thank you. Appreciate that.
Hygiene practices. Changes in aging skin include thinning of the epidermis and subcutaneous fat and dryness because of decreased activity of oil and sweat glands. These changes become visible in the feet. In addition, nails become opaque, tough, scaly, brittle, and hypertrophied. Individuals who have not participated in regular exercise often experience a laxity of foot ligaments and musculature, which leads to instability and impaired mobility. Common foot problems of older adults include heel pain caused by tearing of the plantar fascia and foot
musculature,
musculature and metatarsalgia, pain beneath metatarsal head, hammer toes and claw toes, corns and calluses, pathologic nail conditions, ingrown toenails, fungal infections, arthritis, neuropathies that cause diminished sensation of the in the foot. Older persons are also more vulnerable to bunions because feet tend to spread with aging. Usually, the facial hair of the older adults does not grow quickly, thus, a shave is not necessarily required every day. Older adults have fragile skin and require more protection. Be sure bed linens are clean, dry, and free of wrinkles. Encourage older adults to spend as much time out of bed as possible. Use draw sheets and waterproof pads with caution. Accumulation of moisture creates a risk for skin maceration and impairment. So these items.
Okay, so these are just some of the age-related changes that can occur. Okay, and these are some of the problems that you might encounter on the patient. Okay, all these deformities can become a problem in maintaining a good foot care for these patients. Okay, some of them, for most of these patients, it may not cause pain. Okay, but for some patients, it can be painful. But typically, these are some of the challenges that you might encounter. Okay, how would I clean between the digits of the foot, right? Okay, So these are just things that can occur as you grow old, and you might see this on your patients as well. Again, typical setting. Can we identify what do we call this area right here? What do you call the table? What do we call this table right here?
Over the bed table.
That's an overbed table. Okay. So what do we usually put in here?
Leanings,
Their food.
The food,
table,
their personal stuff. Okay, water, right? So and we have the curtain. That's when we provide privacy for the patient. Okay, so this typically what you would see on a patient's room. There's a bedside table, and there would always be the call light access for the patient as well, right? Okay. So noise, odors, lighting, temperature, these are all things that can affect how the patient maintains hygiene as well. Okay, so we want to maintain the noise. Okay, so sometimes unpleasant intrusions of noise are not good. Okay, um, a lot of patients are very sensitive to noises that can cause a lot of fights, and sometimes the people who have roommates. Okay, what about odors? Is that something that you would be concerned about as well?
yes, that would
Lighting,
bother.
temperature, right? Okay.
Yeah.
So skin changes. Let's look at the age-related changes. When you grow old, okay, there is a thinning of the epidermis and your subcutaneous fat. Okay, what is the topmost layer of your skin?
Epidermis.
Okay, and then followed by.
Dermis.
So the topmost layer is what?
Epidermis, and then the dermis.
And then we have the dermis, and we have the subcutaneous fat. Okay, so usually when let me see if I can get some picture. But anyway, okay. Let me see if I can open up a page so I can make you understand this better. You just had your AMP, right? Okay. Layers of the skin. All right, let's focus one. Let me see if I can copy and paste this one. That's not a good picture. Let's see, good picture right here. Let's go for blank. Okay, what's wrong with this one? Let's see.
Do you know why older people wouldn't want to shower? Because I live in an assisted living home. I understand like depression and all that and not wanting to care for themselves anymore.
Mm-hmm.
But there's just genuinely some people that just don't want to shower. And we help them, they're still capable of doing their own showers as well. Do you know like what it is? Like just the actual mobility of it, or
There
what
could
kind
be a
of
lot of reason for it. There are people who are what we call as having that experience of what we call as a failure to thrive, okay, where they're no longer interested in their own personal hygiene, how they look, how they smell, okay. You will be encountering those types of people. Okay, let me go back real quick.
Some of it can be temperature too, because they're cold. They don't want to take a shower and be
That is an
cold.
important consideration as well, right? Okay. Let me see. I don't have a good picture. Copy image.
Usually I can like motivate them, like, oh, you'll feel good, nice and warm after a shower and you can sleep. But some people just really don't want to take a shower, and then I know they have a right to refuse, but there's a certain point where you have to like be like, you have to shower, and then they usually end up, saying like, oh, okay. But
Right,
when
this
it
one's
comes
not
to like
right.
hospitals, are we allowed to, not force them, but are we going to be able to, encourage them? And then what if it gets to a certain point where they just like completely refuse, and that point it's like self neglect?
That's a good concern. How do you deal with those patients?
Well, if you can't convince them, I mean, if it comes to that point, like she's talking, that she's tried everything, that should be something that's taken up among the care team and care plans as to how to deal with it.
This is not being too friendly to me. Let's discard that one. Let's go back to this room right here. Okay. And this is very important for you to understand. Okay. Insert. Let's go for a blank. All right. All right. So basic knowledge, okay, and this is what would help you understand. I'm not gonna talk about the whole thing here, okay. I just want you to focus in this area, okay. So right between the epidermis and the dermis, okay, what do you notice in the shape on this one? See these ridges right here?
Wait, yeah.
Right, you see that ridge right there, right? I'm gonna mark it with red. Okay, what do we call that? What did you learn in your A&P? What do you call that ridges between the epidermis and the dermis?
Interlock.
Hmm?
Interlock fresh.
The interlock what?
Fresh.
That is what is the clinical term for that?
I'm not sure.
Is that the subcutaneous layer?
That's your papilla, your dermal papillae, right? Okay, so that's how to understand. Okay, just imagine this is your dermis and your epidermis, right? Okay, that's what it is. And just like what you said, it's an interlock, right? But this is really an important concept. I always make sure students understand this part. Okay, that is the purpose of your dermal papillae. Okay, it locks, okay, the layer of your epidermis and your dermis. Okay, now what happens to the patient if they become older? And what leads to the thinning of the skin is when their subcutaneous layer, their fatty layer, becomes thinner as well. Okay, so that means the skin becomes really, really thin. Okay, so if you have this usual pattern on your dermal papillae, okay, as they thin out, okay, they become wider and sparse as well. Okay, so that means the way it would lock the dermis and the epidermis is not as good when you have a healthy skin. Okay, all right, and this is the reason why when we say we move our patients by what? Do we drag them or do we lift the patients when we move them up in the bed?
Lift them.
We want to use the draw sheet to lift them up and put them up or adjust their position, right? Never drag the patient. This is where the problem is. This is how the skin breaks, okay? Because patients with thinner skin now, okay, and the dermal papillae becomes sparse, it can slip, okay? So that means that there can be a separation of the epidermis and the dermis. That leads to a skin injury in the patient. All right. So this is pretty strong. okay, that dermal papillae, no matter what you do, if I slide myself, my butt onto my chair, right, it's not going to cause any injury to me, okay, because my dermal papillae is still okay. Once it starts to thin out and it snaps out, okay, what happens to you? You get an injury. Now, there's a lot of female here. There's a lot of women, ladies in our class. Okay, how many of you wears high heels, or what do you call those? Like those 4 inches
Pumps or
pumps. Okay.
pumps.
All right. How many of you wear those? How many have you have developed blisters?
Every time.
Every time, right? Okay. So that constant movement, if you're wearing those pumps, why do you have blisters on your foot when you wear those pumps? Okay. Every time you wear them, there's constant movement of your skin, the dermis and the epidermis. And because of the constant movement as you're walking, maybe you've been using it for hours, okay, that dermal papillae becomes weak and now it starts to separate. Okay. When that skin separates from the dermis and the epidermis, now you develop the blister. All right. So that is the reason why we need to understand this concept right here. Okay. But what causes the blister? It's the inflammatory process, right? Does anybody know? You already discussed inflammation, right? What are the cardinal signs of inflammation again?
Swelling,
Swelling. What else?
redness,
Pain,
Redness.
redness. What else?
Hard to touch and loose after use.
Calor, dolor, rubor, tumor, functionalesa. That's how you will remember. Those are the 5 cardinal signs of inflammation. Okay? Heat, pain, swelling. What else? Redness and loss of function, right? There's no going around. Okay? Your body will have any injury to the skin, any injury, any infection to your body will go into what we call as the inflammatory response. Okay? So just like going back here, if you're wearing your heels, your pumps, right, and it snaps out, okay, you develop a blister. Okay? That is an inflammatory response. It becomes red, it becomes painful. Okay? That is the clinical manifestation of an inflammation or an inflammatory response. Okay? Same thing with your patient. If you drug them up or down, that causes a friction on an already thin papillae, okay, that can lead to a lot of skin tear on the patient. Okay? Sometimes you rub the patient, okay, not too nicely in a very rough way, that can lead to abrasion in the patient. Okay? That can lead to the separation. Remember, it's a very thin layer between the epidermis and the dermis. Okay? And when this breaks and when this dermal papillae becomes weak, that becomes a problem to the patient. That's an important thing that you should remember as well. Okay? So going back to the equipment, we have the bedside stand, the bed, overbed table, the chairs, and the lights, of course. We have the overhead lights on the back of the head of the patient, the bathroom call light, and the bedside call light, which is important to be always with the patient. Okay? So let's review our positions here. Fowlers to high Fowlers. Okay? Head of the bed raised to 45-degree angle or more up to 90 degrees. Okay? That is the range from Fowlers to high Fowlers, meaning from a 45-degree angle head of the bed elevation, which is Fowlers, to a high Fowler position, which is 90 degrees head of the bed elevation. Okay? So when is this appropriate? Okay? We can put our patients in this position if you are feeding them. Okay? If they are risk for aspiration, this would be a good position for the patient